The NHS is under increasing pressure to evolve and improve patient care as healthcare professionals across the country are presented with increasingly complex medical needs. Amgen has partnered with the NHS Cancer Vanguard to provide hospital trusts with a range of options to deliver out-of-hospital administration of cancer medication to help improve the patient experience as well as provide cost efficiencies. Let's see how this collaborative approach is helping transform the way healthcare services deliver cancer treatment.
The NHS is looking at new ways of delivering healthcare to relieve the pressure on our hospitals and to improve the quality of people's care. If patients have to come into hospital for treatment, they may face long journey times, expensive journeys, waiting times when they get here, disruption to their work or childcare. So new services out of hospital can have a double benefit: improved, more personalised patient care, and also it can free up capacity in places like this. University College London Hospital's NHS Foundation Trust is an NHS Cancer Vanguard site. One of the aims here is to develop transformational care delivery models.
So the Out of Hospital project was really looking at how we can come up with a model that can be applied to lots of different types of cancer treatments, taking those treatments out of a hospital setting like this, much closer to patients' homes.
And to achieve this, the key word has been collaboration.
It's a real coming together of the NHS and industry to do something different. It's been a very different approach.
Here they partnered with leading biotechnology company Amgen as part of the Pharma Challenge, working together to deliver a range of options for the out-of-hospital administration of cancer medication.
We know that there's challenges in the NHS, and it's only by the industry, Amgen, working with the NHS and really putting the patient at the centre of that challenge that we can come together and try and find a solution to a problem. And I think with this partnership we've been able to start small, working with the Vanguards, and see how we can work together.
With the goal of treating patients closer to their own homes, they tackled a specific challenge.
So patients with breast cancer sometimes need other treatments as well, for example, to strengthen their bones. This treatment, because of funding reasons, is delivered in the hospital setting, but it doesn't actually need to be.
So a model has been developed suggesting the patient's injections could, for example, take place in a primary care setting, be administered by nurses, or even done in their own home. Paola Domizio was diagnosed with breast cancer in 2008, but a few years ago she was told her situation had got worse.
Cancer's a cruel disease. I was diagnosed with widespread metastatic disease in my bowel, in my bones, in my lymph nodes, in my liver. I was, as you can imagine, utterly devastated again. This was the second time I'd been through a cycle of devastation.
As a result of her cancer, Paola now needs regular injections to stop her bones weakening. She's now administering these herself at home under the responsibility of her doctor.
I was facing a journey in having an injection that took 1 minute and then having the journey back, which was a total waste of time. So now being able to do the injection at home is an absolute godsend, because it saves me the time having to go in, it saves me the journey, very difficult journey, very painful sometimes journey in there. And at home now I can do all the things that I couldn't do.
This project means patients save time and also money. Macmillan Cancer Support estimates that patients spend on average £170 a month on travel for treatment. And of course, there are cost savings for the NHS with the freeing up of capacity. The hope now is that small pilots like this can be shared and spread right across the country.
It's very exciting. This is a model which is easily scalable and replicable, so it can benefit many more patients across the NHS. I think it's also a model which has shown to support the financial sustainability of the NHS by drawing in their expertise and to a degree some investment from industry partners.
So, a collective effort from the pharmaceutical industry, government and the NHS can create a shared responsibility to improve patient care in the future.